From a budget increase for the Premier's office to getting the Green Line back on track and the growing concern over measles. Time now for tonight's politics panel. And joining us this evening, Calgary-based public opinion consultant Janet Brown and Sarah Elder, founder of the political fashion brand Madam Premier, host of the Briefing Note, and a former political staffer. Good evening to you both. And let's begin with Premier Smith defending a budget increase for her office, up nearly 23% because it now includes remnants of the so-called energy war room. The Canadian Energy Centre was created in 2019 by then Premier Jason Kenney to combat misinformation about Alberta's energy sector. And while the centre was shut down last year by the Smith government, the Premier says the nearly $5 million being added to the budget of her office is to help continue the centre's energy advocacy. Janet, I'll start with you. Discussions around the increase came up during a legislative committee meeting Tuesday when questions were being asked by opposition members, UCP backbenchers as well. How do you weigh the Premier's office assuming responsibility for promoting the oil and gas industry?
Well, in these economic times where there's so much uncertainty and you've got a government running a deficit, this is not a time where you want to look at the budget and see a line item that's increasing by double digits. So of course the opposition were going to ask questions, and the Premier said this is reflected mainly by the fact that they've absorbed what we have been calling the war room, the Canadian Energy Centre. So I'm not sure if those numbers add up, but that's what the Premier is talking about. But there's a lot of people covered by Executive Council, and it's kind of hard to know exactly where the money is being spent. But I'm not surprised the Premier had a ready answer for why the numbers in her office have gone up, because, as I said, in these kind of times, the opposition is going to be looking for any big increases, and this is one of the biggest department increases that we see in the current budget.
Sarah, how defensible is this budget increase, given the degree of contention over the energy war room in the first place?
I think let's put the issue of the energy war room aside, because as far as I'm concerned, and I hope as far as the UCP is concerned, it has been dismantled and no longer exists. Do I think that the Premier saying that she needs additional public funds to best advocate on the interests of Albertans and our oil and gas industry? Is that easy to say? Yes. And is that, I think, as simple of an argument that could be made that people would be willing to accept given everything that's happening in the world right now with Trump and tariffs? I do. I think that this is a mess of their own making, and I think it's a communications problem, and I think it would be easy to fix if they were a little bit more willing to address things from a proactive way instead of a defensive one.
Janet, how do you see this resonating with Albertans, especially in the wake of a provincial budget forecasting a deficit of more than $5 billion and plenty of talk now of cuts here and there?
Yeah, well, you know, Albertans, we don't like paying taxes, but we like to have great social programs. I've said it many times on this program. You know, Albertans aren't so much fiscally conservative as they are tax averse. So I think keeping our taxes low was the most important thing that people wanted to see out of the budget. And they got a tax cut for sure, but they also got an increase in education property taxes. So layer that on to the fact that the public also wants to see government cut expenses, right? So we're talking about a big increase in one department where the public was sort of promised a cut to red tape, a cut to bureaucracy. And so I think the public's going to be frustrated that they didn't see the Premier step forward and actually figure out how she could run her office a little leaner, a little meaner.
All right. Next up, Calgary's contentious Green Line, LRT, back in the headlines, with the federal government signaling it's still committed to the project by approving the updated route plan that will see the new LRT line being built from Shepherd to Victoria Park. At the same time, an elevated track is designed through downtown. The Alberta government also endorsed the plan, saying its portion of the funding would only be available if a tunnel isn't used through the core. According to the province, design work could be completed by 2026, with construction starting the following year, a timeline the mayor disputes.
I'm not sure where they're getting that information from. They should probably consult with us since we're tasked to do that work. We cannot rush this thing. This is an important infrastructure project. It is on the backs of Calgary's taxpayers. We need to get this right.
The business case for the updated $6.2 billion project submitted to the federal government by the province, and with Ottawa now signing off, construction on the southeast portion can start again. Sarah, I'll start with you this time. How surprised are you the feds giving approval of the revised business plan, given the degree of heated debate between the city and the province over how to move this forward?
Well, I think how this happened is kind of important because there was no one here on the ground making this announcement. It was done really quietly, which to me is a sign that they don't want to be answering questions about this project. Honestly, in my mind, from a political staffer point of view, if I was Ottawa, I would be ready just to say a pox on all of your houses, just get it done. So no one was here making this announcement, which, otherwise governments love making announcements about money that they're spending. So I honestly, I hope, express my frustration on behalf of Calgarians that agree with me. I am so frustrated by all of this. And even listening to the mayor's comments and reading comments from the province on this, honestly, you guys need to get your house in order. You need to talk. We expect grown-ups to be at the tables making these decisions and using our tax dollars to the best of your ability. And right now, it looks like you couldn't manage building a Jenga tower.
Janet, where do you think this leaves not only concerns over the future of the multi-billion-dollar project, but the degree of politics at play between City Council and the Smith government?
Well, every time we hear an announcement about the Green Line, it's always a struggle for me to try and figure out whether I think it's a step forward and good news or whether I think it's bad news. So on the surface, this seemed like good news that, on the eve of a federal government, we got a commitment for funding that, that's a good thing because it means that we won't be kicking this federal funding down the road. Now, there's no guarantees with another government, but anyway, it seemed like a good assertion on the part of the federal government to earmark this money. But then to find out that the mayor wasn't looped into this announcement, it seems to be very, very dysfunctional. We haven't talked about a lot. Haven't heard this in the news today, but the city is worried about the liability of this project and who would cover escalating costs. And as we're facing down tariffs and things, the city has to be very concerned about this. So it's a complex project. And of course, everybody needs to be rowing in the same direction, and it's clearly not what's happening.
Okay, time for us to take a bit of a break. But when we come back, rising measles cases and alarm over low vaccination rates. More from our politics panel in a moment. Welcome back. We heard from infectious diseases expert Dr. Craig Jenne off the top tonight on the growing number of measles cases in our province. Janet, let's start on the government's response. We heard a clip from the health minister off the top of that conversation with Dr. Jenne. What do you take away from Adriana LaGrange's change of tune over the span of just a few days and now fully endorsing 2 doses of the shot?
Well, one of the things that Dr. Jenne said that really hit home with me is that there seems to be sort of 2 main problems here in Alberta. And this is a rising sense of vaccine hesitancy, which was exacerbated by the COVID-19 vaccine and people like Adriana LaGrange and others in government who were saying things like, if you're confident in your immune system, vaccinations are a choice. And I know that COVID is different from measles, but it really did sort of provide a mixed message on whether, as a government, we think vaccinations are a good public health strategy or not. And then the other problem is the lack of people with family doctors. How many people are unvaccinated or children are unvaccinated because they've made a choice to be unvaccinated? And how many of them just haven't really had a consultation with their doctor to figure that out? So there's sort of 2 problems. It's nice to see that Adriana LaGrange is giving a full-throated approval to this vaccine, but it's unfortunate that support for the measles vaccine didn't come sooner.
Sarah, what does the change of positioning on vaccination signal to you, and how likely is that to have an impact on Albertans?
Well, I think this is a signal that vaccinations are absolutely necessary and that this is a conversation that I wish we weren't having to have. And I say that as first and foremost, a mother of young children. And I understand that this conversation about vaccines and personal choice is really, really tough for some people. And there is a lot of fear and misinformation out there. And we need to change the way we have these conversations with people. People don't want to be told outright in some cases to have their children or even themselves vaccinated. So the way that we go about this and the way that I hope Minister LaGrange goes about this is really thoughtful, and that there is a concerted effort to have conversations around why vaccines are necessary and how they prevent disease and can even prevent death in some cases. And so we need to have kind of a coming together in the language that we use. But I also want to call out the NDP because I've seen some of the language that they've been using. And frankly, it will do nothing but continue to alienate those who are on the edge of indecision or who have made the decision not to get vaccinated. Calling people, things that will only build the resentment and anger on top of everything that we experienced during the pandemic will do nothing to increase vaccination, which is what we need to do.
Janet, should the number of measles cases continue to rise? At what point do you see this growing to being a discussion around pressure on Alberta's healthcare system?
Well, of course, there'll be pressure on the healthcare system as this grows. And, and I'm not the disease expert. I'm glad you had Dr. Jenny on. He talked about how highly contagious this is, right? So part of the problem is if kids get sick and they need treatment, unfortunately, our crowded emergency rooms, our crowded doctor's offices are the last place for somebody with a highly infectious disease like this to be. So it could be our healthcare facilities that really become the vector for spreading this quickly. This is the place that you should be going for healthcare relief. This should be the place where you're most at risk of catching an infectious disease.
Sarah, we're just looking at the video there. Echoes of the pandemic here for you. Where do you see this heading?
I mean, I'm going to say, again, as a mother, this really concerns me. And I hope that for any parent out there listening to this conversation right now, I want to reassure you as an individual to another individual that I, as a mother and as a community person living in our community, believe in the efficacy of vaccines, including the MMR vaccine. And I have made the decision to protect my children. And I hope if you are uncertain about that decision, that anyone listening to this, if you're uncertain, please go and have these conversations with a family doctor or call 311. There are ways for you to have these conversations in a non-judgmental way about the decisions that you've made, and it's not too late to protect your kids.
Janet, how political do you see the measles response getting moving forward, given how far behind Alberta is on vaccination rates?
Yeah. Well, I hope we can avoid it becoming political because this has been a very divisive, contentious issue because of COVID. But the MMR vaccine is not the COVID vaccine. So whatever opinions that you have on the COVID vaccine, as Sarah said, talk to a healthcare professional, find out what's involved here. And also keep in mind, it's not just protecting your own children. It's about protecting society. So you may not be worried about your own child and what the effects of measles on them could be, but that child could inadvertently spread measles to an infant or somebody who hasn't yet been vaccinated or had an effective vaccine shot. So yes, I think the point of this is we don't want this to become political. Let's not conflate this with the struggles we had over the COVID vaccine, the COVID vaccination.
All right, we'll leave it there. Good to see you both. Thank you kindly for this.
Thanks.